Obviously our sight's very important to us. Could these procedures be a little risky?
Yeah, we're supposed to say that, but I think if you look through the cases recorded of loss of vision, it's mainly related to the use of local anaesthetic and a form of anaesthetic where there is no anaesthetist present. And I've actually saw one case report, for example, where it was in New York, America, where it was being done under what we call sedation. So sedation is one way of doing it, but you have to have an anaesthetist present. And in this country, no surgeon would give a local anaesthetic, a sedation, and then proceed to surgery, because the patient would be confused, disorientated, and possibly drift off to sleep and not have control of the airway. They would have problems. So the blindness in the case in New York was because the patient had that difficulty and effectively had a stroke. And it wasn't the eye that was the reason of the blindness, it was the stroke that affected the visual part of the brain, the back of the head. And as far as I'm aware, well, I don't think I've ever heard of it in the United Kingdom, but if it has, it's not been broadly published. And if it was, I'd really like to see what the circumstances were, because nearly always it's related to low blood pressure or ineffectual care under the anaesthetic. In other words, an anaesthetist has to be present that is aware of what can go on and around eyelid surgery.
So as far as stitches go, how long am I going to need them for, and also are they not going to scar?
Facelifted eyelids, the stitches are taken out on a weekly basis. So the first week, the eyelids have a stitch that just goes a quick pull, and you don't really see the scarring at all, really, from the outset, although it is there. You can get what we call little milial cysts, little white cysts in the scar, and that can go on for about 6 or 8 weeks afterwards, and sometimes those need to be winkled out with little hypodermic needles. But generally speaking, everything settles down really well from that. With a facelift, you have 2 lots of stitches and some clips. And the stitches in front of the ear and the clips at the top of the head, they usually come out on the 2nd week. And the ones behind your ear tend to all dissolve. And there are some deep stitches you don't even know are there, and they stay forever. The ones in front of the ear, if they are starting to get inflamed or infected, they would tend to get to mark. But in plastic surgery world, we don't tend to get that type of wound. So you shouldn't really see those stitch marks as time goes by.
And how long before the bruising goes and I can see the final results?
The bruising goes on through all the colour changes for between 2 and 3 weeks. But what you will be advised to take is arnica, witch hazel, anything you can think of to speed up that bruising phase. We also give you some anti-bruise medication when you're asleep on that sort of one-off sort of basis. You tend to be a bit racy after the operation, a bit stimulated, a bit euphoric, and you just got to remember to keep yourself calm, because the more racy you are, the more you'll tend to bruise. So you will be asked to wear cool packs, face packs, things to keep things immediately from bruising, and then after it's all about arnica and speeding up the whole phase of where you should bruise.
Finally, the nose. Now, what procedures are available and what exactly would they entail?
The nose is actually probably the most important group of patients for selection correctly. If you choose the wrong patient to operate on with the nose, you run that risk of the dysmorphic causing problems, because the nose is the most important part of the visual contact with the face. And what you first look at when you look at a face is the eyes, the big, big dark eyes. And if your nose is big, people then tend to look to the mouth and nose, and then they stay on the nose and they don't have the eye contact. Now in your case, your eyes are wide and nicely separated, and they're big and brown. So the nose is not your focus from the front view. But when you look side on, quite clearly you have what I would call an ethnic nose. And a lot of people with that type of frontal curve would argue that it's a sign of royalty. You know, if you are of Middle Eastern origin, you would not want your nose doing if you were royalty. On the other hand, if you're Caucasian, then virtually nobody likes the forward profile when they look at themselves on side view. So front view is no problem, it's the side view. Your nose is very central, and you've got a very good upper lip distance. The problem would be if you were very short here, for example, we'd have to reduce your nose height. So yours is a fairly straightforward one. You just reduce the bump and make it probably slightly curved forward. Do a little bit of work around the tip, and then just elevate it so it's slightly more of an angle up, because the male nose tends to be fairly square, the female is really sort of a turn up and then turn again. So you're somewhere between the two. So you take the bump and you turn it up, and you generally reduce it by narrowing it. And you'd have to have your plaster on for a good couple of weeks afterwards. Now we see much more difficult noses. Your skin is great for that type of work. Some people have very thick, coarse skin, and particularly men. So when a man wants his nose operation, we've got to be really, really careful, because the man is generally those most at risk of the dysmorphic syndrome. It can happen with women for sure, but mostly it's men that get into that difficulty. Thick-skinned people don't do well with nose jobs. You can do whatever you like to the skeleton, the thick skin is the splint, and it retains that fairly full shape. Probably the best noses to operate on are where the skin is very, very thin, but not so thin that when you do the bony breaks, you end up with bony spikes.
So can you tell me what packs are? How long will they need to be in? And also, will I need to wear plasters?
Because we have to break the bone, you see, and the idea is you've got to stabilise it, so that we put a plaster on the outside, and because I'm pressing on the outside, we're tending to push everything in. We use a pack to help support the inside airway, if you like. It also means that we can press the membrane inside the nose to the outside skin, so therefore it slows down the bleeding process. The packs, it varies, but we normally take the packs out the next day. Now, obviously doing it at the Chelmsford Medical Centre, it's day surgery, so you'd probably go home with the packs in, unless we really were sure you weren't going to be the sort that will bleed on us overnight. And then we'd get you back the next day, sometimes even 2 days later, and you'd come to the experienced nurses who would then look after you downstairs in the outpatients. They'd make sure you're well rested, calmed, and not in any way agitated, and they take the packs out, and you can bleed a little bit afterwards. So we put little nose bags on for an hour or two, and then you can take that off thereafter. So the packs stay in 24 to 48 hours. Some surgeons take them out early. I just feel as though it's probably better just to be a bit careful, wait the 24 to 48 hours. With regards to the plaster, again, this is a broken bone now we're talking about. We've broken the nasal bones to bring them in. And a broken bone takes at least 6 weeks to be solid. At 2 weeks, though, it's fairly sticky. At 1 week, it's still fragile. So I tend to leave the plaster on for 2 weeks, although we can take it out less than that. And I know some surgeons take the plaster off at a week. My view is that the nose will swell straight after the plaster comes off, and that swelling pulls the bones out of place. So when the swelling then goes down, you don't quite know where the bones are going to end up. So we quite like to be fairly solid before we take that off at 2 weeks. And then your nose looks as though it's a bit tightened in. And there's a huge emotion with that, a huge emotion. You first look at your face, and it's not you. It is a different person that you're looking at, because the nose is something that's fundamental to how you appreciate your own body image. And often there's tears. Often there's tears. And it takes probably an hour before it then starts to swell a bit. And then you start to get a wee bit more confidence. And that swelling goes on for the next couple of days until it then starts to regress. And the plaster on your nose has made you look a bit sticky, a bit spotty. And it takes probably the best part of a week to get that skin tone back again. So from about the 3rd to 6th week, you really are getting the benefits of your nose job. And you'd feel your best at 6 weeks. And when I see you in the clinic, generally speaking, everything's nicely down. But there's remodelling going on in your nose for up to 18 months. So I should know roughly what's happening at 3 months. And usually we say goodbye at that stage. You know, you should forget you've had the operation. But remember, there could be change going on for 18 months. And we have an open door. So if there are issues over that 18 months, you just give the secretary a call and we see you.
So how long before I can get back to my normal life, going out dancing and playing sports, things like that?
The 6 to 8 weeks is the general rule with the high impact stuff. Contact sports, you'd obviously be 3 months perhaps before you really want to get in there and do sort of contact karate. We do get boxers. I have to say we get boxers. And boxers by and large are a different breed because they can dislocate the cartilage off the bone. And so I've actually seen some guys take the cartilage right off and poke it back and then bring it back out again when they want the camera shots. So there are different groups of people we operate on, and we can actually sort of vary when to go back to sport depending on what their nose is actually looking like. Some people argue that the bones are stronger after they've been broken and reformed than they were before that.
Professor Frame, thank you so much for spending time with us today, and I'm sure that you've addressed many of the queries that a lot of us have about these cosmetic procedures. There are many cosmetic procedures available for the face, with many questions and perhaps concerns relevant to each. I hope that in the last few minutes you've been watching, we've been able to answer some of those and put your mind at ease. If you've got any further questions, or if you'd like to make an appointment to see one of our consultants, call the number on the screen or check out our website for more information. And don't forget to watch Your Day of Surgery, where I'll be looking at the journey you'll undertake on the day of your procedure. In the meantime, from all the team at the Chelmsford Medical Centre, thank you for watching.